Thanks so much. And thank you all for being here and for the work that you've done on this issue and for this meeting. I want to end with a reflection on the opportunity that exists today. I mean, I think that we've reviewed the data, and there's no doubt we are facing a public health crisis that is truly the crisis of our generation, that's going to define this period of time like HIV did the 80s and 90s. And we need to look at how we can come together and change what we're doing to turn that around. And when we look at the opportunities, I mean, I appreciate the calls for additional funding and new programs to be established, but I think the place to start is to look at the resources that we have available right now, to look at how we can truly transform and change the way our systems work to leverage existing resources to make a huge difference in people's lives. One example of this is what the Ryan White program has done. Dr. Laura Cheever, who heads up that program, has set a goal that all people who are co-infected with HCV in that program will be cured. They've used money from the Secretary's Minority AIDS Initiative Fund to build the demonstration projects that show how this could be done and are now ready to work toward achieving that goal. The opportunity that we have right now, I think, is really the chance that only comes once in a lifetime. Regardless of what you think about the politics of the Trump administration, this is an administration that is willing to tackle the hard problems, that is willing to change things by turning it upside down and to really be a disruptor, and to leave the systems fundamentally different and changed than they were at the start. I think we have to look at how we've been doing things, how we do our work, how the funding streams work, how the policies, procedures, systems, and structures are organized in alignment with the funding. We need to think about how issue-specific funding, issue-specific service delivery, and issue-specific programs and accountability for results changes the way we approach people and the problems that affect their lives. At a minimum, it seems like we need more braiding of funding at the local level. But actually, opportunities could exist at the federal level for that braiding to occur so that the agencies receiving the funding on the local level would not bear the burden of separate accounting for the separate funding streams. We can look at flexibility in how funding is provided to grantees. For example, in CDC's National Center for HIV, Viral Hepatitis, STD, and TB Prevention, they allow 5% of the funds to be used to address cross-cutting issues. I think we're going to need to be looking at models like that and thinking about what are the ways that we can change the way we do the work so that we truly put the patient at the center of everything. Regardless of what door the person comes in, we look at what the person needs to have the best, healthiest, and longest life. And we work to provide those services in an integrated and coordinated fashion that truly puts the person at the center of it all. I think that we also just really have to check ourselves, quite frankly, and step out of our own self-interest. Think beyond what our academic training is, job we're holding, and thinking about how this can benefit us and my field and how I can get a part of this to do more of what I need to do to really think about the system, the community, and the people whose lives are truly destroyed by this epidemic. And the last thing I want to leave you with is the opioid epidemic is a national crisis, but I think we're so often tempted to focus just on the one shiny new thing or the one biggest problem. I think there's an opportunity for us to broaden our perspective here and think more broadly, for example, about substance use disorders. We're seeing increases in methamphetamine use in some states. These are interconnected problems, and quite frankly, we're repeating the same old series of problems again and again with a different focus. We did crack cocaine. That was a huge problem. Addressed that, got some control over it, moved on to the next thing, to the next thing, and to the next thing. And quite frankly, we need to be looking at these issues from a higher level and addressing overall dynamics of substance use disorders, of addiction, and the systems that allow them to grow and remain unaddressed. I think a whole person approach and putting the person at the center of what we do is key to improving individual health, keeping families together, and to building strong and healthy communities. So I thank you for the work that you've done here today, and I look forward to what comes out of the meeting report and the actions that follow it. So thank you so much.